Complaints about services in government health centers and hospitals are commonplace. On Monday, Cabinet approved a bill that, among other things, requires Ugandans above 18 to buy an insurance premium. Those in informal employment will pay 100,000 shillings annually. The figure for the other categories is yet to be determined. The State Minister of Health for General Duties Sarah Opendi says the scheme will help improve the services in the sector, which critics say is ailing.
With this national health insurance scheme, we expect to generate some revenue because we are aware that most of the people are actually paying for health care, but under the table.
There is lack of enough staff, equipment and medicines in some health facilities, which Opendi says will be resolved prior to utilizing the grant from the Netherlands government.
To ensure that all our regional referral hospitals and general hospitals are actually equipped.
According to Opendi, every Ugandan above 18 will only access medical care after presenting their insurance card.
Really, if you are asked to pay, say, 50,000 for a year, can you fail to do that? How much money do we pay every time we go to either bribe our health workers we are sick? People pay 20, 50,000. How much do people spend drinking alcohol, even in the villages, by the way?
Besides that, there has also been reports of mismanagement of funds. I therefore asked Opendi as to what guarantees there to ensure that what people will be contributing to the government coffers won't end up in wrong pockets.
This will not arise. We are aware that, yes, drugs have been stolen before, drugs continue to be stolen, but that should not be the case now. We shall have regional bodies established that where you can actually make a complaint.
Dr. Fred Muhumuza, an economist, says the system will experience hurdles given the numerous protracted problems in the sector.
The budget has grown, but the service has not improved. So even here, they need to know that there are structural issues within the healthcare system itself, including corruption, bad planning, failure to address critical path issues that are very core to the delivery of healthcare, that are not related to availability or the lack of availability of money.
Although the minister argues that 4 out of 10 people access healthcare through out-of-pocket spending, Dr. Muhumuza cites the dangers involved.
Now you might be a situation where employers pay for healthcare, the employees still don't get it, and employees will still be absent for longer days than normal.
Locals have their views about the new proposals.
We needed this yesterday, considering that many people are just medical bills away from slipping back into poverty.
Personally, I find it very hard to go and spend money to a dentist because I find it expensive and I usually prioritize many things.
How can an old person go to a hospital like my grandmom, like now? She doesn't have any money, she doesn't have anyone to help. So it's really hard. Government should see and think about it.
Government is projecting an annual revenue of 409 billion shillings in a period of 4 years from the scheme. The proposal seeks to operationalize the scheme in the financial year 2020-2021. Sudil Biarhanga, NTV.